But what if I told you that there are certain warning signs, signals from your body, that could help you take control before things get worse? In today's video, we are diving into the top 3 nighttime signs every arthritis patient must never ignore. These are the red flags that could mean your arthritis is flaring up. Knowing how to manage them could help you reduce pain and inflammation, and get back to living your life with more comfort and ease. So grab a seat, take a deep breath, and let's get into it. It's time to take action and give your body the care it deserves. Number 1. Persistent joint stiffness and swelling. Let's talk about something many arthritis patients experience but often overlook: persistent joint stiffness and swelling, especially at night. If you're waking up and feeling stiff or noticing your joints are swollen, pay close attention. This isn't just an uncomfortable feeling. It could be a sign that your arthritis is becoming more active or your inflammation levels are rising. You get through your day, do your best to manage symptoms, and go to bed hoping for rest. But when you wake up stiff, swollen, and even tender to the touch, it's like your body didn't get the memo that you were supposed to be resting. Persistent stiffness and swelling, especially in the morning, can be an early warning sign that the inflammation in your body isn't being controlled. Your body is telling you something. It might be time to take a deeper look at your treatment plan. When your joints become swollen, it's often because fluid is building up due to inflammation triggered by arthritis. If left unchecked, it can cause further joint damage over time. The key is catching it early. If your joints are feeling stiff and swollen more often, it could mean your current approach isn't addressing the underlying issue. Here's what you can do. Combat inflammation naturally. Turmeric is a powerful anti-inflammatory. Add it to your nightly routine, either as a supplement or a warm turmeric tea. Increase omega-3 fatty acids in your diet. Found in salmon, walnuts, and flax seeds, omega-3s help reduce inflammation and support joint health. Eat an anti-inflammatory dinner. The right foods in the evening can make a big difference the next morning. Stay hydrated. Dehydration can worsen inflammation. Drink enough water throughout the evening, just not too much right before bed. Stretch before bed. Gentle stretches can improve flexibility and ease stiffness. Just a few minutes can make a difference. Try heat therapy. Applying a warm compress or heating pad before bed can promote blood flow and relax your muscles. If you've been experiencing stiffness and swelling for a while, speak with your healthcare provider. You might need to adjust your medication or routine. Don't ignore what your body is trying to tell you. Take steps to reduce inflammation, stay hydrated, eat well, stretch, and listen to your body. Managing arthritis is a journey, and every little step you take matters. You've got this. Number 2. Increased joint pain during the night. If you've ever experienced a night where your joint pain flares up out of nowhere, you know just how disruptive it can be. It's like your body decides to throw a curveball right when you're supposed to be resting. You lie down, get comfortable, and then, bam, the pain starts creeping in, maybe even disrupting your sleep. This isn't just inconvenient, it's a red flag. Nighttime joint pain can be a sign that your arthritis is progressing or that your inflammation levels are spiking while you sleep. When the body is at rest, we often become more aware of pain that was masked by daily activity. But if the pain becomes intense or regular during the night, that's a signal you should never ignore. Now let's talk about why this happens. When you sleep, your body goes into repair mode. But for people with arthritis, inflammation may not decrease the way it's supposed to. In fact, it can ramp up. Your joints aren't moving, circulation may be slower, and inflammation can pool in those areas, causing more pain. Another reason for nighttime pain. Your sleeping position. If you're putting pressure on sensitive joints or not supporting your body properly with pillows and mattresses, your joints can be aggravated while you're trying to rest. So what can you do about it? Start by optimizing your sleep environment. Make sure your mattress provides enough support. Medium firm is often best for arthritis patients. Pillows can also be a game changer. Use them to support your knees, hips, or back depending on where you feel the most pain. You can also use a body pillow to help keep your spine and joints in a neutral position. Experiment with different setups until you find what feels best. Next, consider a warm bath or shower before bed. This can help relax your muscles and joints, improve blood flow, and make it easier to fall asleep without pain creeping in later. Adding Epsom salts to your bath may offer even more relief due to their magnesium content, which helps reduce inflammation. If pain is persistent, topical creams with ingredients like menthol, capsaicin, or CBD may offer temporary relief. These creams work by distracting pain receptors and soothing inflammation on the surface level. Also, don't underestimate the power of routine. Going to bed and waking up at the same time every day helps regulate your body's internal clock and improve sleep quality. A consistent routine can reduce stress hormones, which are often responsible for triggering flare-ups. And if all else fails, don't suffer in silence. Talk to your doctor. If nighttime pain is interrupting your sleep regularly, it could mean that your medication isn't working effectively anymore, or that it needs to be adjusted. Chronic pain that interferes with rest can lead to a vicious cycle. Less sleep equals more inflammation, and more inflammation means more pain. Addressing the issue head-on could save you from worsening symptoms. Remember, your body is communicating with you. When pain starts becoming a pattern, it's your signal to act, not just to soothe the symptoms, but to find and fix the cause. Coming up next, the third and final nighttime sign that arthritis patients should never ignore. It might surprise you, but it's something many people overlook, and it could be affecting the quality of your sleep and your overall well-being. Number 3. Frequent tossing and turning or restlessness. Have you ever gone to bed and found yourself waking up every couple of hours, flipping from one side to the other, trying to get comfortable? That restlessness may seem harmless at first, but if you're living with arthritis, it could be your body's way of crying out for help. Frequent tossing and turning isn't just about poor sleep. It's often a hidden sign that your joints are in distress, even if the pain isn't sharp or intense. When your body can't find a comfortable position, it's usually because inflammation or joint stiffness is making certain postures intolerable for long periods. This restless sleep can lead to what's known as non-restorative sleep, where you technically get hours of rest, but wake up feeling just as tired, stiff, or achy as when you went to bed. Over time, this type of disrupted sleep can worsen inflammation and even lower your pain threshold. But here's the thing, this constant tossing and turning can also be a signal that something else is going on. Poor circulation, nerve irritation, or even low magnesium levels can all contribute to sleep restlessness in arthritis patients. And let's not forget the role of mental stress and anxiety. If you're worried about your condition or feeling overwhelmed, that anxiety can physically manifest as restlessness. So what can you do to stop the nighttime shuffle? Start by tracking your sleep patterns. Use a sleep tracker or an app to monitor how often you wake up, how long you stay awake, and what might be causing the interruptions. Sometimes, just identifying a pattern is enough to help you correct it. Then, create a wind-down ritual. This could include gentle stretching, a short meditation, or writing in a journal to calm your thoughts before bed. These habits reduce cortisol levels, which are linked to inflammation and nighttime restlessness. You might also consider using weighted blankets. These can help calm the nervous system and reduce the need to move around, especially if anxiety is part of the picture. And here's a pro tip: practice joint positioning. That means aligning your joints in ways that minimize stress while you sleep. Use pillows between your knees, behind your back, or even under your arms, whatever it takes to reduce pressure on sore areas. If you're still tossing and turning night after night, it's time to speak with your doctor. They may want to evaluate whether your arthritis treatment plan is adequately managing your symptoms, or whether something deeper, like fibromyalgia or sleep apnea, could be at play. So let's recap. Unexplained fatigue, increased joint pain at night, and restless sleep or tossing and turning. Each of these could be a sign that your arthritis is progressing, or that your current treatment isn't doing enough to protect your joints and preserve your quality of life. Don't ignore these signs. Your sleep is more than just downtime, it's when your body heals. And if arthritis is robbing you of that healing time, it's time to take action. If this video helped you better understand your body's signals, don't forget to like, comment, and share with someone who needs it. And if you'd like more content like this, hit that follow button. Thanks for watching, and remember, your health starts with listening to your body.